a somewhat delicate palpation, so again, just notify your patients. I'm going to be putting my hand in front of your hip. I'm going to be putting my hand on the underside of your butt. Is that okay? For now, it's going to have to be. So, yeah, turn this way. Okay, so my hand is at the front. How do you guys find the front of the hip joint? ASIS, and then what? You kind of drop off a little bit and move a little bit inferior, right? And then the IT, how do I get to the IT? Under the gluteal fold. Okay, so if I'm here, and again, I'm giving a lift. I'm not jamming anything anywhere because if I'm doing a biomechanical correction, my hand is here and I'm pulling that hip back. Okay, this is a facilitation of what muscles? And lower glute. Okay, so if I'm here, now if she tries to squat, am I going to get in her way? Yeah. Probably. So I have to back myself up a little bit and just squat to about 70. Good, and back up. Okay, and I can see what's happening down the chain. If that works, what do I do? Cue. So the cue that we like to give here is imagine a line between the two greater trochanters and pull them together just like a millimeter. That's usually what I like to say. And don't bias the front, bias a little bit more the back. Remember, they're back here. Just pull a little bit back. Good, and try and relax. Just a little bit, just a little bit. Okay, squat again. And up. So biomechanical correction is up here, external stabilization ITs, then we follow up with the cue of the line between the greater trochanters, but make sure that does not pull them into an adduction moment, because that's the most common give we're trying to fight. You may have to put your hands on their greater trochs and give them a little bit of a guidance that it should be a little bit outward, that they're biasing the line towards the back. Remember, trochanters are a little bit more posterior. So if they're pulling them together, it should facilitate slight external rotation, getting those deep rotators. If your patient is okay with it, you can palpate under the ITs to feel the activation of the lower glute, which honestly I do recommend because that's the best way to tell that they're actually getting the muscles you want them to get. So I think that's it. Oh yeah, no, the other one to get the psoas, I usually use the greater trochanters. The other one to get the psoas is similar to the GH, draw the socket in. So you may have to take them to the mat, distract the hip, and give them that same kinesthetic awareness that you gave them with the shoulder. So draw into the hip or externally rotate. Another one you can do to give them that kinesthetic awareness is if my hands are on her ITs, I can say really sit down into my hand here as you come down. Sit, 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 sit. Good, and up. Okay, that'll also draw the hip into the socket a little bit. So that's more of a kinesthetic cue. Try it.